Okay, so once again, good evening, everyone. Myself, Dr. Rijul Agarwal, will be having a discussion on orthopedic appliances and skeletal maturity indicators, which are very important. We'll be looking up at some images of these appliances, which are very important for your upcoming INI CET exam in November. Okay, so once again, myself, Dr. Rijul Agarwal, I am orthodontic faculty at DAMS. So starting with orthopedic appliances. So what are these? Basically, before knowing about orthopedic appliances, what is these appliances and what are they? What is the need for? So the disproportion, the size or the position of the jaw with respect to the cranial base can result in discrepancy in three planes of spaces. That is either sagittally, coronally, or transversely. So to approach or to correct this problem, okay, there are three management approaches which we can do. Either we can go for growth modification, okay, camouflage treatment और surgical correction. Growth modification में आते हैं हमारे these orthopedic appliances and myofunctional appliances. Okay, camouflage का मतलब क्या होता है? That we are not correcting the skeletal problem, we are hiding. Camouflage means hide, to hide, hiding the skeletal problem by just managing the dental issues. We're just managing the dental issues either through via extraction of premolars or incisors depending upon the case. And lastly is the surgical correction, that involves the orthosurgical option. Okay, so right now and in a further series of lectures over the coming months, we'll be looking about growth modification using orthopedic appliances, and the next few lectures on myofunctional appliances. Okay, so beginning with these appliances first. So the Bunin was the first to use the term orthopedic appliances. Okay, and Norman Klingstad was the first to use the extraoral forces for the correction of these protruding teeth. So what is the basic mechanism behind orthopedic therapy? So it is aimed at correcting the skeletal imbalances with the correction of any or little or no tooth movement which is desired. If required, we'll correct, or not required, no correct. So what is the premise behind it is the forces are very heavy. Okay, generally during tooth movement the forces are in 50 grams, 40 grams. Here the forces are in hundreds of grams, approaching up to thousands sometimes, as compared to the orthodontic forces applied to our simple brackets and wires. So from, as we all know from biology of tooth movement, that when these high forces are applied, they produces hyalinization. Okay, what is hyalinization? That is formation of hyalinized connective tissue. Okay, hyalinized connective tissue बनेगा तो क्या होगा? Tooth movement रुक जाएगी. There will be undermining resorption, that is the cells will come from the, what is undermining resorption? Undermine means sideward or rearward resorption of bone, and we all know that undermine resorption is a slow process. That is, the bone resorption is quite slow. So that what will happen, अगर bone resorption slow होगी, there will be negligible or minimal amount of tooth movement will be seen, and only orthopedic, that is skeletal, only orthopedic or skeletal correction will be seen in this. Okay, so this is the basic premise of biomechanics behind any orthopedic appliances. Those appliances we are going to see. Next, some few points regarding these general points regarding orthopedic appliances is that they are applied intermittent forces. What are intermittent forces? These are applied by patient activated appliances. The patient जब इसको निकाल देता है, force drops to 0. Remember this graph, drops to 0, intermittent, as compared to skeletal forces which are produced by our fixed appliances. कंटिन्यूस का क्या ग्राफ होता था? ऐसे. the force level declines to 0 in between our appointments. So intermittent force apply करना है तो appliance भी intermittently पहनना पड़ेगा. So they are worn for at least 12 to 14 hours per day. Okay, अगर हम ज़्यादा टाइम तक पहनेंगे तो what will happen? The force instead of being intermittent will become continuous, और continuous होगी तो will lead to dental effect which is not desired. We require skeletal effect. Okay, and intermittent forces are less harmful to the teeth and periodontium than a continuous heavy forces. Okay, next comes the time or age of the patient when these forces are applied. So they are applied or effective during the mixed dentition period, that is before the pre-pubertal growth spurt. Okay, growth spurt आने से पहले, that is which one? That is the pre-pubertal. If you remember from our classes, there are a number of growth spurts occurring, first one being in the first year of life. Okay, just at the after birth, 7 to 10 days after birth. Okay, then there is a primary dentition growth spurt, then the mixed dentition, that is the pre-pubertal growth spurt. Next is the timing of force application. So generally it is seen that it is increased, the effect is most with the release of growth hormone. And when does it occur? During the evening and night time, and is associated with sleep onset. That is why if we give it this appliance to a patient, we specifically ask the patient to wear it during post his dinner time, because उस टाइम पे ग्रोथ हार्मोन का लेवल सबसे ज़्यादा हाई होता है, और जब ग्रोथ हार्मोन का इफेक्ट लेवल हाई होगा, it will produce the most effective response during that time. Okay, so this is a classification or characteristics change difference between a force level required to produce skeletal versus the dental changes. So for any dental changes, the force magnitude or the force level is very low as compared to skeletal. Force direction can be any in dental changes depending upon the effect which is desired. In skeletal changes, the force direction is very important. जिस direction में force apply होगी वैसा effect आएगा, and it varies. How it varies and how direction varies, we'll see, and as we discuss subsequent appliances. Treatment time in dental changes varies. The treatment time is long to achieve any kind of skeletal change. Okay, rate of change is 1 to 1 mm per month max. The tooth movement is 1 mm per month maximum, whereas in skeletal changes it is 3 to 4 mm per year. Okay, so the most important point which should remember is the direction and the duration of the force to produce the desired skeletal change. And how it varies, it depends on the type of appliance which we are using. So beginning with the first appliance, that is the headgear. So हर appliance में जो भी हम orthopedic appliances देखेंगे उसमें क्या important है? First is direction, next is duration, and third is the type or the purpose for which it is given. Required or given. Okay, so headgear. So इसका purpose क्या है, किस केस में देते हैं? Patients with excessive horizontal growth of maxilla. Okay, जिन patient में maxillary growth is more, okay, in those cases we require headgear. So what is the mechanism behind it? How does it act? Most effective in the prepubertal period, we have already discussed why it's so. Okay, how does it act? It acts by compressing the sutures, that is the circummaxillary sutures, and restricting the normal downward and forward growth of the maxilla in class 2 patients. Okay, so while at the same time the mandible grows normally. So maxillary growth को restrict किया. Okay, और sometimes अगर हमें उसको force level बढ़ाएंगे, we can distalize the maxilla as well. Okay, so in patients with excessive or horizontal growth of maxilla, this appliance is effective. So what is the biomechanics? ये तो हो गया purpose. Next is the force level and direction. Okay, so force level is 500 to 1000 ग्राम in total. तो पर साइड करके अगर एग्जाम में पूछे तो क्या हो जाएगा, हाफ हो जाएगा इसका फॉर हेडgear. Specifically if they ask you to stop the maxillary growth, it is 600 gram per side. and to redirect its growth it is 600 to 800 gram in total or 300 to 400 gram per side. Okay, direction क्या होगा? Slightly above the occlusal plane through the center of resistance of the molar teeth, and at the force application you choose the molars by the face bow. What is a face bow and what are its components of headgear? We'll see. Force duration is the at least should be 12 hours per day every day, with emphasis on marrying it from early evening right after dinner until next morning. Reason being we have already discussed. Duration of treatment is typically between 12 to 18 months depending upon the rapidity of the growth and patient cooperation. So what are the components of these headgear? First is the force delivering unit, which comprises of the face bow or a J hook. J hook is present on the directly soldered on the arch wire. Means समझने के लिए it is attached directly to the brackets and arch wire and passes through the molar tube present on the bands. Okay, similarly is the face bow. Face bow is not attached to the wire. J hook जो होता है वो arch wire से attach होकर, face bow is not attached to the arch wire. It's a different entity. We'll see in the next few slides. Next is the force generating unit, that is through the coil spring. It is comprised of a nickel titanium coil spring. And lastly is the anchor unit. Anchor unit could be taken through head or neck region depending upon the case or the desired movement which we desire. Okay, so beginning with the first, that is the face bow. Face bow के दो पार्ट होते हैं. It has a outer bow and the inner bow. Okay, outer bow का dimension is 0.051 to 0.062 inch and inner bow is slightly smaller in dimension, 0.045 to 0.52 inch SS. Depending on the size or the length of the outer bow, it can be short, medium or long as compared to the inner bow. Again depends upon the case or part facial morphology of the patient, हम इसको select करते हैं. एग्जाम के लिए आपको ये ध्यान रखना है, इसका डायमेंशन और आउटर बो के 3 हो सकते हैं. एंड लास्टली मोस्ट इंपॉर्टेंट इज द इमेज ऑफ द फेस बो. ओके, सो नेक्स्ट आता है आउटर बो. तो चला जाएगा पेशेंट के बाहर फेस पे. इनर बो गोज इनसाइड द पेशेंट्स माउथ. नाउ दिस इनर बो इज इंसर्टेड इनटू द बक्कल ट्यूब ऑफ द मैक्सिलरी फर्स्ट मोलर्स. ओके, सो मैक्सिलरी फर्स्ट मोलर पे मोलर ट्यूब अटैच होती है जिसमें एक हेडगियर ट्यूब होती है, एक आर्च वायर ट्यूब होती है. सो दिस लूप और द इनर बो गोज इनटू दैट मोलर ट्यूब. ओके, नेक्स्ट वी प्लेस और बेंड द यू लूप ऑन दिस इनर बो. व्हाई? अगर हम डायरेक्टली प्लेस कर देंगे तो इट विल बी अ फ्री स्लाइडिंग बो, वो इनसाइड पूरा चले जाएगी एंड कैन हर्ट द पेशेंट्स चीक और म्यूकोजा. सो वी प्लेस अ यू लूप. इट एक्ट्स एज अ स्टॉप to prevent the free sliding of the inner bow. Okay, so ये हो गया face bow. Next comes the force generating unit, that is the coil spring. So it connects the इस face bow को anchor unit से connect करती है. So इसके अंदर होता क्या है, ये हमें outer, अगर हम इसको open करके देखेंगे तो इसके अंदर एक night type ऐसा spring होता है. It can be pulled out and in. Okay, डिपेंडिंग अपॉन द फोर्स ये आउटर बो इस होल्स में जाके अटैच हो जाता है. आई शो यू द इमेज लाइक दिस. ये आउटर बो गया इन होल्स में अटैच हो गया. किस होल में अटैच होगा विल डिपेंड अपॉन द फोर्स लेवल डिजायर. कितना फोर्स हमें देना है, कौन सी मूवमेंट करनी है, उस बेसिस पे इस होल में डिजायर्ड हो. हाउ डू वी मेजर द फोर्स? वी हैव ऑलरेडी सीन थ्रू अ कोरेक्स गेज. ओके, एंड ये है एंकर यूनिट विच इज हेयर. इट इज द सर्वाइकल एंकर यूनिट. नेक्स्ट इसमें इमेज में है ऑसिपिटल या कॉम्बीपुल हाई एंकर यूनिट. ओके, वर्मी एंकर यूनिट हम विल डिस्कस. सो दिस इज द फोर्स जनरेटिंग यूनिट टू द नाइटाई कॉइल स्प्रिंग. नेक्स्ट इज द एंकर यूनिट. सो दिस इज इन द फॉर्म ऑफ अ हेड और अ नेक स्ट्रैप. हेड पे लग सकता है नेक डिपेंडिंग अपॉन द टाइप और रीजन फ्रॉम वेयर वी डिजायर टू टेक द एंकरेज. Okay, so based on this position of the anchor unit, the headgear can be classified into four types. Cervical pull. Cervical, understood as cervical means nape of the neck. Occipital pull, from the occipital region. High pull, from the parietal or the topmost region. और can be combi pull, जिसमें हम occipital और cervical दोनों region से anchorage ले रहे हैं. ओके, नॉर्मल सी बात है, अगर सर्वाइकल पुल से ले रहे हैं सो इट विल कॉज एक्सट्रूजन ऑफ द मोलर. ओके, और अगर हम ऊपर से ले रहे हैं इट इज इंडिकेटेड इन हाई पुल हेड एंगल केस, मींस अ वर्टिकल ग्रोअर पेशेंट. अगर हम हॉस्पिटल या हाई पुल हेड के ले रहे हैं इट इज इंडिकेटेड इन वर्टिकल ग्रोअर पेशेंट टू कंट्रोल द वर्टिकल ऑफ द पेशेंट. और अगर अब हमारा एंकरेज डाउन है, फोर्स लेवल डाउन से हो रहा है, तो इट विल लीड टू एक्सट्रूजन ऑफ द मोलर. सो extrusion of, so it is indicated in horizontal grower. Okay, extrusion is desired in patients with horizontal grower. So this was the classification. Again, a classification, similar kind of classification given by Prophet, that is high pull, cervical pull or combi pull. So high pull will apply a superior intrusive as well as a distalizing force to the maxilla and the maxillary dentation. Okay, so this is a high pull headgear. और कोई भी फोर्स होता है उसके दो कंपोनेंट होंगे अगर वो एंगल पे हैं, एक ये और एक ये. So the vertical component will lead to intrusive action और horizontal component will have a distalizing action. इंट्रूसिव होगा तो किस में चाहिए होगा, वर्टिकल ग्रोअर में. डिस्टलाइजिंग कंपोनेंट हमें चाहिए होगा जिसमें मैक्सिलरी ग्रोथ एक्सेस, लाइक इन क्लास 2 पेशेंट. सो दिस इज applies a superior intrusive and distalizing force of the maxilla and the maxillary dentation. Similarly, cervical pull produces a inferior extrusive and a distalizing force on the maxilla. Same चीज. सर्वाइकल पुल अगेन दो कंपोनेंट में रिजॉल्व किया, एक हॉरिजॉन्टल एक वर्टिकल. हॉरिजॉन्टल फोर कंपोनेंट से आ रहा है डिस्टलाइजिंग, इससे क्लास 2 करेक्ट हो रहा है. वर्टिकल से आ रहा है एक्सट्रूजन, जो इंडिकेटेड है इन हॉरिजॉन्टल ग्रोथ पेशेंट. सेम चीज. एंड नेक्स्ट इज अ कॉम्बी पुल. सो अगर कॉम्बी पुल होगा जिसमें सर्वाइकल और दोनों से ले रहे हैं तो हमारा वर्टिकल कंपोनेंट बैलेंस आउट हो जाएगा. सो नो एक्सट्रूजन और इंक्लूजन. तो क्या होगा, खाली खाली डिस्टलाइजिंग फोर्स लगेगा मैक्सिला. सो जो एवरेज ग्रोअर्स है वी गिव अ कॉम्बी पुल हेडगियर. सिंपल, easy to understand. Next comes a situation in which the center force level passes in between the center of resistance of the maxilla and the maxillary dentation. अभी तक हमने देखा फोर्स लेवल पास हो रहा है डेंटेशन के थ्रू या मैक्सिलरी बोन के थ्रू. अगर इन दोनों के बीच से पास होगा तो क्या इफेक्ट होगा. सो फॉर दैट वी शुड नो वेयर इज द सेंटर ऑफ रेजिस्टेंस ऑफ द मैक्सिला. इट इज इन द zygomatic maxillary suture region. Okay, so if the force or the outer bow passes below the center of resistance of maxilla and above the center of resistance of the maxillary dentation, what will happen? It will lead to clockwise rotation of the maxilla and the anti-clockwise rotation of the maxillary dentation. So maxillary bone, if you imagine, will go like this. Okay, and maxillary dentation जो इसके attached है will go like this. So होगा क्या, occlusal plane will get steepen. Again indicated in horizontal growers. ये जो भी center of resistance के through या जैसे हम पास कर रहे हैं will all depend upon the case and your diagnosis. What is desired in that case. So exam में no one is going to ask you कि कौन सा type of headgear या from where you will pass through. They're just going to ask you अगर हॉरिजॉन्टल ग्रोअर है सो व्हाट काइंड ऑफ डायरेक्शन ऑफ हेडगियर विल यू गिव, वर्टिकल ग्रोअर है व्हाट काइंड ऑफ मैक्सिमम. फर्स्ट क्वेश्चन विल बी ऑन बेस इमेज. थोड़ा सा मुश्किल करना है तो इमेज के अंदर इंडिविजुअल कंपोनेंट पूछ लेंगे. या थर्ड दे विल गिव यू अ बिग केस बेस्ड सिनेरियो जिसमें सारी हिस्ट्री मेंशन होगी पेशेंट की, या सेफ वैल्यूज मेंशन होगी. बेस्ड ऑन दैट यू डिड्यूस दैट्स अ हॉरिजॉन्टल ग्रोअर. सो व्हाट काइंड ऑफ हेडगियर विल यू गिव. और फर्स्ट या लास्टली जो मोस्ट कॉमनली आस्क्ड क्वेश्चन इज द टाइप ऑफ अप्लायंस, वेदर यू विल गिव गो फॉर ऑर्थोपेडिक अप्लायंस और नॉट. सो उसमें आपको कीवर्ड्स देखने होंगे, पिवटल ग्रोथ स्पॉट, एज ऑफ द पेशेंट, CVMI, skeletal maturity indicator, like that. Okay, so next comes the next appliance, that is face mask. So as I've already told you, कोई भी orthopedic appliance में हमें पहले देखना है उसका purpose. Next is the direction of the and the duration of force. So अभी हमने देखा था headgear was for the excessive or increased growth of the maxilla. अब आता है face mask. तो face mask किस लिए indicated है? Face mask is indicated in जिसमें reduced growth है maxilla की. तो अगर ऐसा होगा तो क्या होगा? There will be class 3 skeletal pattern. तो अभी हमें क्या करना है, ग्रोइंग फेज में पेशेंट का मैक्सिला हमें आगे लाना. सो दिस इज थ्रू फेस मास्क. सो बिफोर बिगिनिंग एनीथिंग वी शुड नो द साइंटिस्ट. सो इट वाज पॉपुलराइज्ड बाय डिले एंड टेक्स एंकरेज फ्रॉम द चिन एज वेल एज फोरहेड बोथ टू पुल द मैक्सिला फॉरवर्ड. Hickam was the first to use the face mask, most effective in young growing patients up to the age of 8 years. Okay, next it was advocated the use of RME along with face mask. Why? Because maxilla जब पीछे होता है, it's not पीछे sagittally, there is deficiency in transverse dimension as well. So to expand it transversely also RME is indicated. Okay, so it works best in young growing children around 8 years. Indicated in class 3 skeletal malocclusion with retruded maxilla. Okay, and it's also known as reverse pull headgear. Why? Headgear का उल्टा है, exactly opposite. So this is a face mask. Headgear was behind in this region. Face mask is completely opposite. So it's also known as reverse pull headgear. Most commonly used term in your exams. So what are the biomechanics? 300 to 500 grams of forces per side. Okay, direction of force will be 15 to 20 degree in downward direction to the occlusal plane. So this is the occlusal plane, it's in downward direction. Okay, so that's how it will pull the maxilla forward. Okay, so line of occlusion or line of force is passing below the center of resistance of the maxilla. So what will it produce? It will produce a counterclockwise movement on the maxilla and the dentation. Okay, hence to prevent this counterclockwise rotation, the force is directed downward. And similarly, अगर maxilla पे होगा तो maxilla से नीचे हम mandible, it will lead to downward and backward rotation of the mandible, which is desirable in a class 3 situation. Maxilla आगे आ रहा है, mandible पीछे जा रहा है, downward and backward rotation में class 3 हमारा correct हो जाए. So this is desirable. Duration of wear is 12 to 14 hours per day to produce intermittent forces. Age is primary or early mixed dentation. Optimal time is after the eruption of permanent maxillary center incisors, that is around 7 to 8 years. Okay, and generally differ until first permanent molars and incisors have erupted. So this is an indication that the patient should have erupted upper incisors and permanent first molars. Anchorage is taken through the chin and forehead. Force generated is through heavy extraoral elastics. There it was through coil spring. Okay, here it is through heavy extraoral elastics. Okay, in case of vertical growers, elastic wear is parallel like this, not downward. Downward होगा तो rotation होगा, which will further increase the vertical. So in vertical growers, the elastic wear is parallel. Okay, inside, what is the force delivery unit? Through a wire framework or the Hyrex. So through this hook, the elastics are attached to the outside this region framework. So यहाँ पर ये दिख रहा है elastic इससे attached है, inside it goes to this framework and this framework is on a RME appliance, that is a Hyrex appliance, rapid maxillary expansion. Okay, so there is forward movement of 2 to 4 mm in 8 to 10 months which occur. There are two types of face mask, that is a delayer or petted type. So this is a delayer type face mask and petted type. Okay, important for image. Okay, so this was the केस जिसमें मैक्सिलरी ग्रोथ रेट्रूडेड है. हमने एक्सेसिव मैक्सिलरी ग्रोथ देख ली, रेट्रूडेड देख ली. अब हम आते हैं मैंडिबल पे. सो फॉर दैट वी हैव अ अप्लायंस दैट इज चिन कप. सो चिन रीजन नाम में ही है, रीजन इन द रीजन ऑफ चिन. ओके, एंड इंडिकेशन क्या है इसका? इन एक्सेसिव मैंडिबल growth this appliance is given. So it's a pre-found appliance given by Oppenheim. Okay, so this is the chin cup appliance given in excessive mandible growth. Line of direction. So there are two ways to use this chin cup. First is the line of force acting directly through the condyle. What is the function? Given with the intention of impeding the mandibular growth. Okay, अगर डायरेक्टली सेंटर ऑफ रेजिस्टेंस से पास होगी जैसे हेडगियर में था, व्हाट विल हैपन? मैंडिबुलर ग्रोथ स्टॉप हो जाएगी. और अगर उसके नीचे पास होगी तो इट विल व्हाट विल कॉज डाउनवर्ड एंड बैकवर्ड रोटेशन ऑफ द मैंडिबल लाइक दिस. अगर इसके थ्रू पास हो रही है ग्रोथ स्टॉप, अगर इसके नीचे है तो इट विल कॉज डाउनवर्ड एंड बैकवर्ड रोटेशन लीडिंग टू करेक्शन ऑफ क्लास 3 एडोप्शन. Okay, force level is less, that is approximately 2 to 3 pounds or 800 to 1200 gram in total. Per side will be half of that. Okay, so what was the effects which you will see? There will be increase in facial height. Why? Because of the downward and backward rotation of mandible. Okay, leading to decrease in the prominence of the chin. Anterior facial height will increase. Okay, and lastly what effect will be you see? It can cause lower incisor crowding as well. Why? Because of the action on the chin. Chin के पीछे है lower incisors, so इसका dental effect क्या होगा? Another very important question which in relation to chin cup. Okay, that it can cause lower incisor crowding in the mandibular region. Okay, so this is the image of a chin cup. Chin cup, यहाँ से force है attached, similar strap of headgear taking region anchorage from the occipital region. Okay, it does not have any intraoral component, you just have to wear it extraorally. Okay, so these are the 3 orthopedic appliances. Next we'll have a short discussion over skeletal maturity indicators. So there are number of maturity indicators to assess the growth status of the patient. कोई भी orthopedic या myofunctional appliance शुरू करने से पहले we need to know the skeletal maturity or the age of the patient, the skeletal age of the patient, not the dental age. Okay, then and only then the appliance which we give or the growth modification appliance which we give will be effective. So these are the methods. सारे मेथड डिटेल में याद करने की ज़रूरत नहीं है फॉर योर एग्जाम. ओके, कुछ के नाम आर इम्पॉर्टेंट, कुछ के डिटेल वी नीड शुड नो. सो फर्स्ट इज द एटलस मेथड विच इज गिवन बाय टॉड, ग्रूलिक एंड पाइल एंड थीमन एंड नेट्स. व्हाट दे गिव वाज जस्ट अ एटलस. हमें जस्ट उस इमेज से पेशेंट को कंपेयर करना है एंड बेस्ड ऑन दैट वी कैन क्लासीफाई और गिव द स्केलेटल मैच्योरिटी इंडेक्स और द ग्रेड ऑफ द पेशेंट. सो इसमें है इंपॉर्टेंट नेम. Next comes the Jork, Grave and Brown method, in which he gave the 9 stages of the skeletal maturity indices. Okay, this and the cervical maturity are the important for exam, जिसको हमें डिटेल में जानना. Okay, Hag and Taranger. Okay, similar kind of method है based on hand wrist method. Lastly are the Chetkov method used to analyze tooth mineralization to study the skeletal method. एंड लास्ट इज द डेमिजान मेथड जो हमने आपने यूजी लेवल पे या ग्रेजुएशन लेवल पे पढ़ा होगा बेस्ड ऑन द कैल्सिफिकेशन लेवल ऑफ द परमानेंट 70 of the left side permanent. Okay, so this involves the taking of the OPG and studying the calcification level of the teeth from central incisor to the second molars whether erupted or not, और उसकी atlas से we need to compare. Important thing is the gold standard. This method is considered as the gold standard. Okay, so for first is the hand wrist methods जिसमें हम पढ़ेंगे Fishman skeletal maturity indicators and the Julius Singer. Okay, so from your anatomy classes you all know that hand wrist region is made up of following groups of bones, that is distal end of radius and ulna, the long ones from the forearm. Then comes the carpals which have the 8 bones divided into 2 regions, that is the proximal and the distal. Proximal जो होगा वो hand की तरफ, distal towards the further away. Okay, next come the 5 metacarpals. उसके बाद आते हैं phalanges, 3 in each finger except thumb which has 2. So in total they have 14. And next is the presence of a adductor sesamoid bone of the thumb, okay, which is the most important bone when we assess the skeletal maturity of the patient. So for exam point of view, okay, for Singer method, that is the Julius Singer method and Fishman method, Singer ने use किए थे bone sesamoid, carpals and the phalanges. So mnemonic से याद रखो S for S, Singer is S, sesamoid is S. Radius, ulna and metacarpals he did not use. Okay, Fishman uses 6 anatomical sites, 4 stages and 11 indicators, including the radius, the long bone, the sesamoid and as well as the phalanges. Okay, so Fishman ने सारी bones use की थी. Singer was selective. Okay, remember S for S, and the bones which he did not use, the long bones and the metacarpals. So Fishman के पहला index. So what were the anatomical sites we used, and it divided into the following 4 stages. एग्जाम में आपको ये सब नहीं याद रखना है, आपको जो ध्यान रखना है वो इस दिस डायग्राम. ओके, एंड only the most important stage is this stage 4, that is the ossification of the adductor sesamoid of the thumb. This means that the skeletal maturity is reached. So exam में how do they ask you this question? या तो फर्स्ट स्टेज चीज़ होगी डायरेक्टली पूछ लेंगे इमेज देके, या स्टेज वाइज. ओके, कि कितने इंडेक्स है, कितने स्टेजेस है. नेक्स्ट जो सबसे कॉमनली आपसे पूछते हैं इज ऑन द बेसिस ऑफ अ केस बेस्ड सिनेरियो. अ बॉय ऑफ दिस ईयर्स ऑफ एज comes to your clinic. Okay, on taking a examination or taking a radiograph, you see, या रेडियोग्राफ की इमेज दे देंगे, you see a ossified bone present in the region of thumb. इसका मतलब what kind of appliance will you advise? तो इस केस का मतलब है the patient has achieved skeletal maturity or has passed his skeletal maturity or passed his pubertal growth spurt और spurt शुरू हो चुका है. In that case आप myofunctional या growth modification appliance नहीं दे सकते. That is the significance or the reason for teaching these maturity indicators in detail. Okay, so as I've told, I'm just repeating once again. या तो डायरेक्ट आपसे क्वेश्चन पूछ लेंगे इमेज के फॉर्म में, या कौन सी बोन यूज हो रही है, लाइक आई मेंशन, कौन सी नहीं हो रही है, कितनी साइड्स है, स्टेजेस है, इंडिकेटर्स. आपसे कोई इंडिकेट स्टेजेस का ये नहीं पूछेगा स्टेज 9 कौन सी है, स्टेज 11 कौन सी है. एक ही स्टेज इंपॉर्टेंट, दैट इज द स्टेज 4 जो आई मेंशन फ्रॉम फिशमैन इंडेक्स. आपसे मोस्टली दे आस्क यू इन अ केस बेस्ड सिनेरियो. ओके, नेक्स्ट द सिंगर मेथड. सिंगर मेथड के कुछ इंपॉर्टेंट पॉइंट्स. सो एब्सेंस ऑफ हुक ऑफ हैमेट एंड पिसिवॉर्म, दैट मीन्स देर इज स्टिल 1 year ऑफ प्रीप्यूबर्टल ग्रोथ स्पर्ट. एग्जाम में इमेज में दे कैन गिव यू हैंड रिस्ट रेडियोग्राफ एज वेल, और उसके बेस पे केस बेस्ड सिनेरियो बना देंगे. तो उसको आप क्या कहोगे, इमेज बेस्ड क्वेश्चन कहलाओगे कि किस में डालोगे, इट्स अप टू यू. हमारा काम है आंसर करना. So first is absence of hook of hamate and pisiform. That is, there is still 1 year for prepubertal growth spurt. अभी हम if we start any myofunctional appliance like twin block, it's too early. But अगर हमें कोई orthopedic appliance देना है, is this the right age? Next is the initial ossification of hamilar process of hamate and pisiform, means prepubertal growth spurt start हो गया है, मतलब हम myofunctional appliance दे सकते हैं. Presence of hamilar process of hamate, pisiform and sesamoid, beginning of growth spurt. Again, हमारे फंक्शनल के लिए सही टाइम है. Calcified ulnar and sesamoid, peak pubertal growth spurt आ चुकी है, मतलब अब हमारा myofunctional appliance देंगे तो it won't be as much effective as it was effective before. Next is epiphyseal and diaphyseal fusion of the middle phalanx of the third finger, that is MP3. Ossification of sesamoid is complete. Pubertal growth spurt complete है, मतलब अब growth modification appliance we cannot give. No appliance possible for growth modification. And lastly, the epiphyseal and diaphyseal fusion of radius and ulna has occurred. That means the growth is complete. The skeletal maturity has been attained. Okay. So अब जो अगर ऐसे केस में आएगा तो what will do? The correct answer will be then orthosurgical case for correcting the skeletal deformity. Okay, so a reliable indicator of a pubertal growth spurt on hand wrist film is sought as, that is the ossification of adductor sesamoid. It's very easy, even अगर आप अपनी clinics में या you can try it out in your college using a simple IOP as well. Just keep it between your thumb and here and you will see a round ossified bone. Okay, that is the adductor sesamoid bone. Okay, so next is ossification of hooks of hamate and pisiform marks the onset of prepubertal growth spurt, whereas ulnar and adductor sesamoid का onset है pubertal growth spurt. So prepubertal and pubertal is important. Lastly comes the CVMI staging, that or the cervical vertebra maturity indicator. Why it's important? Because it can be done or found usually very easily on a cephalogram. हमें कोई नया स्पेसिफिक रेडियोग्राफ या हैंड रिस्ट रेडियोग्राफ की ज़रूरत नहीं है फॉर दिस स्टेजिंग. ओके, सेफ्लोग्राम में हमें C3, C2, C3, C4 वर्टेब्रा दिख जाते हैं. सो इट्स अ मोस्ट कॉमनली यूज बाय ऑर्थोडोंटिस्ट while planning their cases. So it was first advocated by Lamprey in the year 1972 and later on popularized by Hassel and Farman in the year 1995. So there are 6 stages. Later on it was modified into 5 stages by combining stage 1 and 2 by Franchi and Bessel. So very popular name in the field of orthodontics for this indicator. So इस स्टेज इस इन में क्या देखना है, जैसे हमने हैंड रिस्ट पे सबसे इम्पोर्टेंट था was the presence of adductor sesamoid bone. In this CVMI stages we have to see 3 bones, that is C2, C3 and C4. उनका shape and lower border. Okay, shape or lower border, whether it's concave, flat or what, is important to assess the staging. So first is stage 1, that is CS1. Lower border to C2, C4 is flat and shape is trapezoid. Clinical significance क्या है, that is peak in mandibular growth will occur on an average 2 years after this stage. Okay, next is CS2. C2 is concave, C3 and C4 are trapezoid in shape, with the peak in growth will occur 1 year after this stage on an average. CS3, the growth will occur within 1 year of this stage. Okay, so अगर patient CS3 में है, you can start myofunctional plans. It's the most common or indicated stage. So एग्जाम में या तो आपको डायरेक्टली अगर एग्जाम इजी बनाना है तो दे विल राइट यू CS3 या इनमें से कुछ लिख देंगे, या बहुत ही मुश्किल बनाना है दे विल गिव यू इमेज ऑफ अ सर्वाइकल cephalogram and based on that you have to decide. Next is CS4, that is the growth on peak in mandibular growth has already occurred 1 to 2 years before this stage. Okay, so from 4, 5, 6, any kind of growth modification appliance you cannot get. Okay, 5, the peak in mandibular growth has ended at least 1 year before this stage. It has ended, already ended. Okay, and last is CS6, it has ended 2 years before this stage. So for 5 and 6, the only option for skeletal correction is through orthosurgical means. Okay, so this is the clinical significance, or the way they will ask you in the exam. Okay, lastly, some facts related to skeletal maturity indicators. So for most development indicators, the correlation coefficient between the developmental status and the chronological age is by 0.8, which means that the chronological age and developmental status of the patient is not 100% related. There is relation of 0.8, and dental age or chronological age ka relation is 0.7. Next, Jork, Grave and Brown gave the appearance of sesamoid on X-ray films as 13 years in male and 10.6 years in females. That is corresponding to stage 4, which I have already told you in Fishman's indicator. Okay. Lastly, frontal ear sinus can be used as a skeletal maturity indicator. Its ossification, the expansion, is used as a indicator for skeletal maturity. How and why? Exam में important नहीं है. You just need to know that this, out of all sinuses, frontal ear sinus is, because why? The nasion point in front of it is the last to grow. मतलब सबसे long time तक it keeps on growing. Okay. Lastly, a question: a tooth whose development is considered valid for the assessment of skeletal maturity is the mandibular canine. Okay, the one with the longest root and the last to ossify, that is the mandibular canine. Okay, so that completes a discussion on orthopedic appliances and skeletal maturity indicators, which are important for before beginning any myofunctional appliance therapy. So from next time we'll have a discussion on myofunctional appliances and fixed function and removal both. Okay, so thank you for your time. Hope my short lecture was productive to you for your upcoming exams. If you have any queries, you can always contact us and clear